everyone, and welcome to today's Meet a Vendor webinar, hosted by Active Health Management, a participant in ShortLister's Vendor Incentive Program. I'm Christy Doe, ShortLister's Meet a Vendor webinar moderator, and I'm so glad you could join us today. Before I turn things over to today's presenters, I'd like to review a few quick housekeeping items, especially for those of you who may be first-time attendees. Our Meet a Vendor webinars take place on Tuesdays and Wednesdays at 1 p.m. Central Time. We use a condensed format of 30 minutes that includes a 25-minute presentation followed by 5 minutes of questions. To submit a question, use the GoToWebinar widget you should see on the right-hand side of your screen. There's a little tab for questions. Go ahead and type them in, send them over to me, and we'll get to as many of those as we can in the time that remains after the presentation. For ShortLister subscribers, our Meet a Vendor webinars are recorded and uploaded onto our platform. If you want to share with coworkers or simply want to revisit the content, click the tab in the top right-hand corner. It actually says Meet a Vendor webinars to access. Additionally, you can head over to Active Health Management's vendor profile to access the recording. So with that, I'm going to hand things over to today's presenters. We have Dr. Jonathan Rubens, Chief Medical Officer, and Gary Buccello, Senior Vice President of Sales with Active Health Management.
Well, thank you, Christy. And thank you to all of you who have taken the time out to learn about Active Health Management here today. Active Health Management is a population health management company that puts the person at the center of all that we do. We'll provide an overview of our programs for you today and trust that you'll see our holistic approach allows for highly personalized interactions. In other words, our tools are designed to support members and coaches so that they can have meaningful connections. Quality is very important to us, which is why we spend the time and resources, have external experts come in and look at our programs. And we think that holding ourselves accountable for quality really helps. And that's how we have these accreditations, NCQA and URAC accreditations across all of our programs. And we encourage all clients to expect this kind of commitment to quality. Our clients are, in general, employers in both the corporate and public arena, public being state programs, local municipalities. Also, we serve unions, TPAs, and providers. A little bit of background regarding Active Health. We've been around actually since 1998, founded by physicians, founded on the principle that medical evidence results in the highest quality of healthcare. And while we have now grown to over 27 million lives covered and we have 1,000 employees, our founding spirit really remains the same. And this pursuit of quality is really what we think results in such high satisfaction from our members that we serve and our clients. I think the other thing that's kind of the good news, if you will, our approach of quality first also yields actual hard dollar savings. And so later we'll also discuss a recent claims-based study that we had that showed a 3.6 to 1 return on investment for our well-being solution. So if we look at our programs, they really cover the entirety of the continuum of health. And this is what allows us to really meet members' needs where they are and be person-centered. And we have solutions that will show you that really range from healthy folks trying to maintain their health and all the way to acute issues that we help people work through. But we also understand that customers often need to mix and match solutions. So our programs are available in a modular fashion, but no matter which way that we deliver our programs, they will always be person-centered. So we're going to present these programs really along two pathways, because we find that when people do break apart these programs, these are kind of the most usual ways that they're done, both on one side well-being, another side kind of medical management. Okay, so the thing that underlies all of our programs, before we kind of jump into the specifics with Dr. Rubens, is that we have invested in a foundation of clinical analytics, which we call the Care Engine. We process data and track it at a member level so that we're able to personalize all of our interactions across our programs and recommend the best next step for each person's health. These algorithms represent medical evidence for 200 conditions, including behavioral health. And staying current with medical literature is no small feat. And so we have a large investment ourselves in physicians, pharmacists, and clinicians who stay up to date with the literature and update the Care Engine constantly. The Care Engine detects risks, but it also communicates. And we communicate what the Care Engine is able to find with members. We communicate with care managers, and we actually communicate directly with physicians. So these care considerations help people receive the best practice protocols for a treatment and result in the best health outcomes possible. Once again, it's really a quality first perspective. So with that foundation, let's get into some of the specifics of the programs with Dr. Rubens.
Thank you, Gary. So first, I'd like to talk to you all about our well-being solutions. Gary said we're sort of thinking about these in two ways today. So let's start with well-being. The basic tenet of Active Health is our focus on the whole person. You hear us use the word whole person, holistic, and it is a really fundamental concept upon which we build what we do. Well-being is really not only chronic condition management, but it can also be lifestyle management or prevention. Well-being can encompass every dimension of a person's health, and we designed a product with that thought in mind. So historically, chronic conditions and lifestyle interventions have been separated in the space in which we work. People thought of one or the other, not both, and didn't consider that connection, the interconnection between those things at the individual level. But now even NCQA has recognized the need for a more holistic view. And they've done away with the old disease management accreditation some of you may be aware of, and are moving to a new population health accreditation that Active Health and other companies are now seeking. We also took that different approach in creating our well-being program. From identification of members through outreach and into engagement, we have really removed all of what we see as artificial distinctions across health and well-being. So our solution identifies and can target people for management across 10 lifestyle conditions and 19 chronic conditions, with support for an additional 20 chronic or comorbid conditions. And that's very important because there are solutions out there today that specifically focus on one or another or multiple chronic conditions, but don't provide the additional support. We know that we need to meet members where they are. And that means we need to have our clinicians have the tools to tackle what concerns that person today. So though we may be identifying populations for these 19 conditions, the comorbid conditions are just as important in having that conversation with someone who, when you speak to them or you reach out to them or you're interacting with them in a digital format, their concern today is a different health problem that is, without addressing that, you'll never get to address the problem for which we've identified them. This helps us drive toward the outcomes that we ultimately desire from the program and really maintains the capability for members to connect with us around their health, wherever they may happen to be on that health journey. Our well-being program also produces measurable results. And on the next slide, you'll see our process is really how we get there. We focus on vulnerable and at-risk and difficult to engage members, but our program also supports the entire population wherever they may be on their journey. And as Gary spoke about, well to chronically ill and acutely ill, and the extremes of age as well. We leverage what we call a digital forward strategy, meaning that a digital front door is the way that most people can find a way in, but there are multiple means of connection with us and with our coaches and our clinicians. And as you consider a well-being strategy, we ask you to ask your customers and think to yourself, does the solution include the three things you see here on the slide? So in identification, are we really harnessing data and analytics in a way that focuses personalized well-being resources to those people who really need them? As you think about engagement, does that engagement employ a team of highly trained specialists who maximize engagement, targeting those people at a personal level rather than a purely clinical level? Are those people able to engage with your members how, when, and where they need to be? And then lastly, motivation. How are we keeping members motivated? How does the program continue beyond identification and engagement to really activation and ongoing health improvement to support their clinical and non-clinical barriers to success? So let's delve a little more deeply into these three steps that are involved. The first of which is identification, as I spoke about. And this really means specific actionable opportunities for health improvement opportunities. Actionable is the key here because we really need to highlight those places where people can improve their health and the things they can do to make that improvement. Just raising the issue is not enough. Helping people find the solution and the mechanism to that is really where it needs to go. And it begins with the data and analytics that Gary discussed around the care engine. But it also goes well beyond the usual identification of the highest risk members or using just self-reported or biometric data. We really leverage extensive data sources, and we can use almost any data source our customers can make available to us. Medical claims, pharmacy claims, laboratory claims, and laboratory values as well. We can also leverage patient-derived data and disability data, EHR data. So using all of those different sources and including social risk, that rich pool of data helps us harness the power of machine learning and a proprietary set of evidence-based clinical rules that gets to the personalization I was speaking about, personalized to the individual level, not just the condition. So not just the same program or messaging for everyone with diabetes, but for the individual and their specific journey with diabetes, not just to a segment of the population, a one-size-fits-all because you're 50 or older or 40 or older, but to the individual themselves. Engagement is equally as important, as I said, and one of the most challenging aspects of our well-being solution is multiple channels where people can connect where, when, and how they want to. And understanding that that connection can be at multiple places and multiple times of the day. So in the morning, someone might want to talk to a nurse coach. In the afternoon, they might want to go in their mobile program. We have skilled engagement specialists who, once they are in touch with members, really have a very high success rate at getting people activated and engaged in the program. And our nurses and coaches employ the principles of behavior change science to make the connections that we really need to make with the members, have the conversations and the interactions that matter, and that lead to an understanding of each individual's motivations around their health and point them to the productive next steps for them. And then with respect to motivation, we've really found, once we found the members and identified them and engaged them, it's about lasting change. It's about lasting behavior change and activation. Our team skillfully delves into those member choices that people make and identifies the tools that help them make that change. We utilize multiple strategies. We understand people are not static. We have people who are very highly motivated. We have people who are plateaued. There may even be folks who we sort of say are missing in action and need particular outreach and handholding to sort of bring them back to the path. Our team really understands that path and the ultimate goals and works to keep people activated and keep their momentum going toward achieving those goals. And that's how we get to the better health and the proven savings. On the next slide is the snapshot of the types of results that this program and that I described really can produce. We've been very successful in achieving significant results. On the left side, you'll see some improvements in lifestyle risks. These are the types of things that we measure over a year or more period of time and 2 data points plus a baseline for members who are engaged in the program. And this is the type of improvement we've seen in reducing these specific lifestyle risks. On the right, you see improvements in clinical outcomes metrics. Some of these are HEDIS type metrics, some are custom, and some can be focused on those parts of the population that any customer needs or has a specific emphasis around. But using some of these national standard and non-standard measures, we're able to objectively measure through clinical claims data improvements in those clinical outcome metrics that we know lead to health improvements and lead to decreased utilization and ultimately to cost savings for members and for plans. But looking at these measures alone is not enough. And so the next slide, we talk about how we went about quantifying the impact of our program and ensuring we had results that could withstand a rigorous examination. On the next slide, you see the study that we undertook is a non-randomized intent to treat retrospective cohort study. There's about 14,000 commercial members identified for our well-being program, and we had a control group with nearly 38,000 members. We measured their impact at baseline and then at years 1 and year 2. And the statistically significant results included a $27.49 per member per month medical cost savings, a 20% reduction in inpatient costs, a 24% reduction in acute inpatient admissions. And these results are validated by the independent third-party validation institute. And we're very happy to share those results with you upon request and more details around this study.
Jonathan, this is Gary. I'm going to interrupt you for a second here just to see if I could take control of the deck from Christy, if you would, so that I could kind of progress to the next slide. It looks like we got stuck there.
Okay, hang on one sec. I am on it. Make presenter, Gary. That should do it right there.
Okay. Is that it?
Yep.
Thanks,
Okay.
Gary. Yep. This specifically speaks to that study that I just mentioned for our well-being solution and the 2-year follow-up study through October of 2020. And as I said, these are the statistically significant results. We did send this to the independent third-party validation institute for their review and approval. And there are a lot more details around the population and inclusions and exclusions, as well as specific information around the cost reductions that we're happy to share with you. Let me go to the next slide, Gary. So also, now we spend a few minutes just highlighting the other product solutions for medical management. These are care management and utilization management. Care management covers a wide variety of case management and chronic condition management programs that really can stand alone or stand together along with utilization management. The key focus of these programs is the right care, the right time, the right setting. And I would add right care is more than just the right procedure or the right drug or infusion or whatever the request may be. It's really beyond the clinical to the cultural. Is it the right fit? Quality of life? Is this how the member wishes to manage their health? And making sure that what is being requested and what is congruent with where the member is and with their health status. I'd also add the fourth thing, which would be at the right cost. Ensuring that both the member and the plan sponsor are getting value for what is being requested and optimizing that member's care. So let's look at each of these programs. Utilization management is one of the things Active Health is known for, our particular flexibility in our solution. Active Health has custom review lists that may or may not be available from large organizations or carriers. And they meet specific customer needs or specific customer emphasis around a condition, let's say. So they may be focused on infertility or bariatric surgery or musculoskeletal conditions. And we can, together with the customer, derive a custom review list that meets that need. We also cover medical necessity as well as clinical appropriateness for those things that are being requested. We take into account each individual member's unique benefit, their clinical, cultural, and social needs, as well as I mentioned previously, and we offer one-to-one peer review with clinicians for all denials in our utilization management. To date, our program has a 98% member and provider satisfaction rate. Case management I really like people to think of as sort of multiple means of care management. So it can be a standalone condition management program, and even around individual or a bundle of conditions per se, or it could be complex case management for specialty conditions, things such as chronic kidney disease, pediatrics and neonatology, maternity, or even advanced illness, compassionate care. Our traditional case management for inpatient and transition of care and length of stay and other functions is coupled with our utilization management program. And in each case, our case managers are certified. They work to resolve those barriers that present with members. They're experienced in a variety of care settings and bring that experience to their care management work. We have multiple specialties represented, and they're supported by a team of medical directors who provide the clinical support for their conversations and interactions with members, as well as consultation with other providers in their care team. And understanding that the role of the care manager really is also to be an advocate for that member and to help them navigate the very complex system in which they find themselves anytime they're interacting with the healthcare system. Our case management program also has proven results similar to our well-being program. So on the next slide, we could talk a little bit about those results. In a recent study we did of 5,600 members in complex case management, we're able to show that the case management program yielded $8.6 million in savings, which was equivalent to $3.70 per eligible employee per month. How did we achieve these savings? It was through reduction in inpatient, and that means both admissions and length of stay or inpatient days, reduction in professional costs, both for inpatient and outpatient, and then 20% reduction in emergency department visits, which really speaks to the level of care management, both in the acute setting and in the outpatient setting that the program is able to deliver. Our message around these care management programs, be it well-being, be it case management, care management of specific type, or utilization management, is that holistic well-being has, we have solutions that deliver these interventions and opportunities that are personalized and that can really yield real dollar savings for both the members and for our customers. So I'm going to hand it back to Gary for some closing thoughts. Gary?
Well, thank you, Dr. Ribbons. We hope that we've shown you some of the clinical rigor of our programs and how we meet the person where they are. There is another critically important part of our holistic approach that I'd like to point out, and that is really to understand the context within which someone lives. And what do I mean by that? Each of us lives not only with our clinical story, but also with a surrounding set of circumstances that impact our lives and therefore could impact our health. This member story here shows how the circumstances around us, the context within which we live, impacts us every day. And it's vitally important for us to be aware of this and to connect with members around these circumstances. This story talks about a member who we were working with in our diabetes program and suffered hurricane damage to their roof, which was repaired, although poorly. The home health agency that was working with her refused to continue treatment with her because they thought that the roof leaking presented an unsafe situation, and so they stopped going in and taking care of her wound care. Our nurse, in discussions with the member, was quick to realize the problems and wanted to work to solve them. Luckily, at Active Health, we also have interdisciplinary teams of not only nurses and coaches, but also nutritionists and social workers. And so the nurse and the social worker quickly got to work and found a local charity organization that was able to complete in a timely way repairs. And then we contacted the home health agency, and that care was resumed in the home. So that, I think, is a good example. We started the presentation off by talking about the power of human connection being a part of our holistic approach. And sometimes that connection calls upon our nurses and coaches to advocate for members in unanticipated ways. It always means that we pay attention to the behavioral health co-determinants and the social determinants like housing insecurity, food insecurity, et cetera, that provide the holistic context within which a member is living, in addition to clinical issues. So with that, Christy, let me turn it back to you for questions.
Perfect. Thank you so much, Dr. Rubens and Gary. That really was a great overview of your program, of Active Health program. A couple things stood out to me. I do like that you're driven, data-driven, that you use clinical analytics. I like the model, the identify, engage, and motivate. And I particularly like your engagement coaches, which, given your last example, Gary, are truly advocates as well. And the fact that you have interdisciplinary coaches, I think, is a real plus. So as you can see, Active Health's contact info is right in front of you on the screen. I encourage you to write that down so you can reach out to them directly. So we are going to move into our Q&A. We do have questions submitted, and we really appreciate that. We want to get to as many as we can in the time that remains. Again, if for some reason we don't get to your question, please reach out to Active Health directly on the email address that you see in front of you on the screen. So, okay, Dr. Rubens and Gary, here's the first question that came in, and I think it's really a good question. I have noticed there are some healthcare companies that only focus on one particular health problem, for example, diabetes. Can you explain how your holistic approach benefits your clients in comparison to these types of approaches?
Christy, this is Gary. If I could start, and then Dr. Rubens could jump in. Some of what we were just talking about in terms of our holistic approach really sees the person as not just one thing, not just their condition. So we exist in that total context, and by having a holistic approach, we are able to work with a person not only on a condition, but on comorbidities or on social and behavioral co-determinants that they're living with. And we really think that by taking this kind of approach, we have a more meaningful interaction with the folks that we work with. Not to mention that we also think there are some inherent problems as employers offer solutions that are so targeted and don't address sort of the overall population. It degrades an opportunity to improve the overall culture of health for an employer. Dr. Rubens, anything you would add there?
Yeah, Gary, I would add, people are not, simple conditions, right? People are complex and come to them with multiple other additional concerns. And this is part of what I was talking about in the 20 additional conditions we prepare our clinicians to work with members around above and beyond those for which they might be identified. If they're speaking to a member that day, they've developed this relationship with a nurse or a coach, and they're turning to them for assistance, and they've been identified, let's say, for their cardiovascular disease, but that day it's their chronic neck or back pain that's the issue. If you don't address that and give them tools or resources or the ability to make improvements in what's troubling them the most, you'll never get the opportunity to talk to them about the cardiovascular disease. It's just the nature of working with people who are far more complex than any specific one or two individual conditions. So, losing that opportunity is a terrible loss, an invaluable way that you want to work with people. The other thing is, for a well-being solution, you want to have something that is available for the whole population, and you're necessarily cutting out slices of the population when you are limiting it to people with only one specific condition, and you don't understand whether or not that one program will be able to stretch itself to wrap around what the rest of the population might need.
I think that's in itself a great differentiator, actually. All right, so this is a fairly quick one, and it might be all we have time for. What types of customers does Active Health have experience with?
Christy, let me just quickly answer. We work with employers corporate customers, also public customers like local municipalities and states. Unions are customers of ours. We also have TPAs, health plans, and providers.
So multiple disciplines. We do have a few other questions, but unfortunately, we've ended up coming to the end of our time here. So thank you so much to both of you, Dr. Rubens and Gary, and your entire team, actually. We appreciate the effort you and your team put into the presentation and for taking the time to share it with Shortlisters community. For our attendees on the line, we always appreciate you tuning in to our Meet a Vendor webinars and want to encourage you again to reach out directly to the team at Active Health if you have further questions or you simply want to learn more about what you heard today. So with that, we've reached the end of our time together. Again, thank you all for joining us, and we look forward to seeing you on the line for our next Meet a Vendor webinar, Tuesday, September 21st at 1 p.m. Central. Until then, take good care, everyone, and have a great rest of your day.